Endometriosis affects around 1 in 9 women, yet most of them spend years not understanding why it's happening. Today I'm going to explain the real causes of endometriosis, the proven risk factors, and what that means for how you manage it. Before we go any further, if you want a plan that directly targets the root causes of your endo, the 4-week endometriosis diet plan bundle is built around the exact biology driving your symptoms. It works on inflammation, estrogen dominance, and gut dysfunction all at once. Get it at 4weekendometriosisdietplanpdf.com. The link is in the description. So what actually happens in endometriosis? Endometrial-like tissue that acts like the lining of your uterus, grows outside the uterus. During your cycle, this misplaced tissue behaves exactly as it would inside. It thickens, breaks down, and bleeds. But because it has nowhere to go, it causes inflammation, forms scar tissue, and creates lesions on your ovaries, fallopian tubes, bowel, and elsewhere. Your immune system should detect and destroy this misplaced tissue, but in endometriosis, it doesn't. Either the immune system fails to clear it, or worse, it becomes dysregulated and actively promotes its growth. This is why endo is classified as an immune condition as much as a hormonal one. Now, here are the 6 leading causes and risk factors. Number 1. Retrograde menstruation. This is the most widely accepted theory. During your period, some menstrual blood flows backward through the fallopian tubes and deposits endometrial cells outside the uterus, where they implant and begin to grow. Number 2. Genetic factors. Women with a first-degree relative with endometriosis, a mother or sister, are 7 to 10 times more likely to develop it themselves. Specific gene variants affect immune response and estrogen metabolism. Number 3. Immune system dysfunction. In most women without endo, the immune system destroys misplaced endometrial cells. In women with endo, it doesn't, and the chronic immune activation this creates is responsible for much of the pain and inflammation. Number 4. Estrogen dominance. Endometriosis lesions actually produce their own estrogen, making them self-sustaining. They are estrogen-dependent, which means higher estrogen levels directly accelerate lesion growth and worsen every symptom. Number 5. The stem cell theory. Research suggests that bone marrow stem cells may migrate to sites outside the uterus and differentiate into endometrial-like tissue. One explanation for why endo is sometimes found in the lungs and other distant locations. Number 6. Gut and environmental triggers. Growing research links endometriosis risk to gut microbiome imbalances, dioxin exposure, and dietary patterns that promote estrogen dominance and systemic inflammation. Here is what the science actually shows. Women with a first-degree relative with endo are 7 to 10 times more likely to develop it. Women with endometriosis go undiagnosed for an average of 7 to 10 years. 40% of women with infertility have endometriosis as an underlying and often undetected cause. And 75% of endo patients report significant symptom improvement after eliminating inflammatory trigger foods. The diet you eat directly affects 3 of those 6 causes. It regulates estrogen clearance through your gut microbiome, it controls the systemic inflammation that drives immune dysfunction, and it determines whether your hormonal environment promotes or fights lesion growth. The 4-week endometriosis diet plan bundle targets all 3 of these drivers at once, with a complete meal plan, recipes, and shopping lists that eliminate every trigger food and replace them with meals that work with your biology. Get it at 4weekendometriosisdietplanpdf.com. Now here are 4 steps to take control right now. Step 1. Get a proper diagnosis. Endometriosis can only be definitively confirmed by laparoscopy, but ultrasound and MRI can strongly indicate it. If you have had symptoms for more than 6 months, push for a specialist referral. Step 2. Understand your estrogen. Ask your doctor for a full hormone panel, including estradiol, progesterone, and SHBG. Your estrogen levels guide both your medical and dietary treatment plan. Step 3. Fix your gut first. Gut microbiome imbalances worsen estrogen recirculation and immune dysfunction, both of which directly feed endometriosis. An anti-inflammatory, gut-focused diet is the most powerful first step you can take. Step 4. Build an anti-inflammatory diet from today. Every meal is an opportunity to reduce the inflammation and estrogen dominance driving your endo. Eliminating gluten, dairy, red meat, refined sugar, alcohol, and trans fats, and replacing them with anti-inflammatory foods is the most direct lifestyle intervention available to you. Now tell me, which cause do you think is driving your endo most? Genetic, immune, hormonal, or diet-related? Drop it in the comments, and I'll give you a specific step based on what you share.